Welcome to the Professional Development course ADHD Awareness, brought to you by Kayamishi Tech's Workforce and Economic Development. In this video, we will cover: what is ADHD, types of ADHD, symptoms, causes, myths, diagnosis, treatment, tips for teachers. What is ADHD? Attention Deficit Hyperactivity Disorder is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, may act without thinking about what the result will be, or be overly active. There are three types of ADHD. ADHD, predominantly inattentive presentation, what used to be called ADD. ADHD, predominantly hyperactive impulsive presentation. ADHD combined presentation. Predominantly inattentive presentation. This is also known as ADD or attention deficit disorder. It is hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversations. The person is easily distracted or forgets details of daily routines. Kids with this condition aren't hyperactive. They don't have the high energy levels seen in others with ADHD. In fact, children with this form may seem shy or in their own world. ADD is diagnosed if a child under age 16 has 6 or more symptoms of inattention, 5 or more for older teens, for at least 6 consecutive months, but no signs of hyperactivity/impulsivity. Symptoms of predominantly inattentive presentation: trouble paying attention, easily sidetracked. Doesn't like or avoids long mental tasks, such as homework. Trouble staying on task during school, at home, or even at play. Disorganized and seems forgetful. Doesn't appear to listen when directly spoken to. Doesn't pay close attention to details. Loses things often. Makes careless mistakes. Struggles to follow through with instructions. Children with this subtype of ADHD may go undiagnosed because the symptoms may be chalked up to daydreaming. Predominantly hyperactive impulsive presentation. The person fidgets and talks a lot. It is hard to sit still for long, example, for a meal or while doing homework. Smaller children may run, jump or climb constantly. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It is hard for the person to wait their turn or listen to directions. A person with impulsiveness may have more accidents and injuries than others. Symptoms of predominantly hyperactive impulsive presentation: blurting out answers before a question is finished. Constantly interrupting others. Trouble waiting for their turn. Talks too much. Fidgeting, tapping, and squirming. Gets up when it's not appropriate, such as when the teacher is talking or in the middle of dinner. Running or climbing in inappropriate situations. Unable to play quietly. Always on the go. Combined presentation. Symptoms of the two types are equally present in the person. Because symptoms can change over time, the presentation may change over time as well. Thanks to brain imaging studies and other research, we know a lot about ADHD. But there are still many myths that cause confusion and make it hard for people with ADHD to get the support they need in school, at work, and in their communities. Here's the reality behind 8 common myths about ADHD. Myth number 1: ADHD isn't a real medical condition. Fact: the National Institutes of Health, the Centers for Disease Control and Prevention, and the American Psychiatric Association all recognize ADHD as a medical condition. In fact, it's one of the most common conditions in childhood. Millions of kids and adults in the US have it. Research shows that ADHD is hereditary. 1 out of 4 people with ADHD have a parent with ADHD. And imaging studies show differences in brain development between people with ADHD and people who don't have it. Myth number 2, people with ADHD just need to try harder. Fact, ADHD isn't a problem of motivation or laziness. Kids and adults who have it are often trying as hard as they can to pay attention. Telling people with ADHD to just focus is like asking someone who's nearsighted to just see farther. The reason they struggle with attention has nothing to do with attitude. It's because of differences in the way their brain functions and how it's structured. Myth number 3, people with ADHD can't ever focus. Fact, it's true that people with ADHD usually have trouble focusing. But if they're very interested in something, they may focus on it intensely. It's called hyperfocus. Some kids with ADHD are easily distracted in class but can't pull themselves away from a game they're playing. Adults might have trouble focusing on the parts of work they find boring, but they pour themselves into aspects they really like. Myth number 4, all kids with ADHD are hyperactive. Fact, the stereotype of kids with ADHD is that they race around and can't stop moving. But not all kids with ADHD have hyperactivity as a symptom. And for those who do, hyperactivity usually goes away or lessens as they get older. There are 3 types of ADHD. One doesn't have an impact on activity levels at all. This type of ADHD is sometimes called ADD, and it mainly impacts attention. Myth number 5, only boys have ADHD. Fact, boys are more than twice as likely as girls to be diagnosed with ADHD. But that doesn't mean girls don't have it. They're just more likely to be overlooked and remain undiagnosed. Part of the reason is that ADHD can look different in boys than in girls. Girls tend to have less trouble with hyperactivity and impulse control than boys do. They may seem more daydreamy. Myth number 6, ADHD is a learning disability. Fact, ADHD isn't a learning disability. ADHD symptoms can get in the way of learning, but they don't cause difficulty in specific skills like reading, writing, and math. Some learning disabilities often co-occur with ADHD, however. That might contribute to this myth, too. But just because ADHD isn't a learning disability doesn't mean kids can't get help in school. And adults with ADHD can often get support at work, too. Myth number 7, kids with ADHD will outgrow it. Fact, most kids don't totally outgrow ADHD, although some symptoms can lessen or disappear as they get older. Symptoms may also change as kids get older and learn ways to manage them. But that's not the same as outgrowing them. Most people with ADHD continue to have symptoms into adulthood. Myth number 8, ADHD is the result of bad parenting. Fact, ADHD is caused by brain differences, not bad parenting. But some people see kids fidgeting, being impulsive, or not listening and assume it's due to a lack of discipline. They don't realize that what they're seeing are signs of a medical condition, and not the result of something parents or caregivers did or didn't do. Causes of ADHD. Scientists are studying causes and risk factors to find better ways to manage and reduce the chances of a person having ADHD. The causes and risk factors for ADHD are unknown, but current research shows that genetics plays an important role. In addition to genetics, scientists are studying other possible causes and risk factors including brain injury, exposure to environmental hazards, example lead, during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Diagnosis. Deciding if a child has ADHD is a process with several steps. There is no single test to diagnose ADHD, and many other problems, like anxiety, depression, sleep problems, and certain types of learning disabilities, can have similar symptoms. One step of the process involves having a medical exam, including hearing and vision tests, to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents, teachers, and sometimes, the child. DSM, 5 criteria for ADHD. Healthcare providers use the guidelines in the American Psychiatric Association's Diagnostic and Statistical Manual, 5th edition, DSM-5, to help diagnose ADHD. This diagnostic standard helps ensure that people are appropriately diagnosed and treated for ADHD. Using the same standard across communities can also help determine how many children have ADHD and how public health is impacted by this condition. 6 or more of the following symptoms for children 16 and younger, and 5 or more of the following symptoms over the age of 16. The symptoms of inattention have been present for at least 6 months and inappropriate for developmental level. Often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or with other activities. Often has trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. For example, loses focus, sidetracked. Often has trouble organizing tasks and activities. Often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, such as schoolwork or homework. Often loses things necessary for tasks and activities, for example school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, mobile telephones. Is often easily distracted. Is often forgetful in daily activities. Hyperactivity and impulsivity. 6 or more of the following symptoms for children 16 and younger, and 5 or more of the following symptoms over the age of 16. The symptoms of hyperactivity and impulsivity have been present for at least 6 months and inappropriate for developmental level. Often fidgets with or taps hands or feet, or squirms in seat. Often leaves seat in situations when remaining seated is expected. Often runs about or climbs in situations where it is not appropriate. Adolescents or adults may be limited to feeling restless. Often unable to play or take part in leisure activities quietly. Is often on the go, acting as if driven by a motor. Often talks excessively. Often blurts out an answer before a question has been completed. Often has trouble waiting their turn. Often interrupts or intrudes on others, example, butts into conversations or games. Treatments. When a child is diagnosed with attention deficit/hyperactivity disorder, ADHD, parents often have concerns about which treatment is right for their child. ADHD can be managed with the right treatment. There are many treatment options, and what works best can depend on the individual child and family. To find the best options, it is recommended that parents work closely with others involved in their child's life, healthcare providers, therapists, teachers, coaches, and other family members. Types of treatments can include behavior therapy. The goals of behavior therapy are to learn or strengthen positive behaviors and eliminate unwanted or problem behaviors. Behavior therapy for ADHD can include parent training in behavior management, behavior therapy with children, and behavioral interventions in the classroom. These approaches can also be used together. For children who attend early childhood programs, it is usually most effective if parents and educators work together to help the child. Medications. Several different types of medications are FDA approved to treat ADHD in children as young as 6 years of age. Stimulants are the best known and most widely used ADHD medications. Between 70 to 80% of children with ADHD have fewer ADHD symptoms when taking these fast-acting medications. Non-stimulants were approved for the treatment of ADHD in 2003. They do not work as quickly as stimulants, but their effect can last up to 24 hours. Medications can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication, but not to another. Tips for parents/teachers. Create a routine. Try to follow the same schedule every day, from wake-up time to bedtime. Get organized. Encourage your child to put school bags, clothing, and toys in the same place every day so that they will be less likely to lose them. Manage distractions. Turn off the TV, limit noise, and provide a clean workspace when your child is doing homework. Some children with ADHD learn well if they are moving or listening to background music. Watch your child and see what works. Limit choices. To help your child not feel overwhelmed or overstimulated, offer choices with only a few options. For example, have them choose between this outfit or that one, this meal or that one, or this toy or that one. Be clear and specific. Let your child know you are listening by describing what you heard them say. Use clear, brief directions when they need to do something. Plan ahead. Break down complicated tasks into simpler, shorter steps. For long tasks, starting early and taking breaks may help limit stress. Goals and praise. Use a chart to list goals and track positive behaviors. Then let your child know they have done well by telling them or by rewarding their efforts in other ways. Be sure the goals are realistic, small steps are important. Discipline effectively. Instead of scolding, yelling, or spanking, use effective directions, timeouts or removal of privileges as consequences for inappropriate behavior. Promote strengths. Children with ADHD may find certain situations stressful. Finding out and encouraging what your child does well, whether it's school, sports, art, music, or play, can help create positive experiences. Healthy lifestyle. Nutritious food, lots of physical activity, and sufficient sleep are important. They can help keep ADHD symptoms from getting worse.